This is a normal cephalic birth. So the first thing we want to do when we arrive at the scene is we want to prepare our patient. So here we want to make sure mum is nice and comfortable, and we want to obtain a full obstetric history. So we want to ask about things like any risk factors or complications she's had with this pregnancy, as well as any antenatal information she does have, including the position of the baby and the number on board. We also want to ask how far apart the contractions are and the intensity. If they're too intense, we can offer pain relief at this point. We also want to know about previous pregnancies, so how many mums had, as well as any risk factors or complications that may have occurred with those. We then want to make sure that we have our proper PPE on, so here we're looking for our gown, our gloves and our glasses. And we want to check our maternity kit. So we want to make sure we've got blueies, pads, clamps and scissors, as well as bulb suction catheters if they are required. We then want to make sure this is an aseptic area as best as possible, and place a bluey under mum. We're then going to prepare for the birth of the head of the baby. So here we want to apply 2 fingers of pressure on the cephalic region of the baby to ensure that it's not coming out too fast to prevent tearing. As the baby's head is born, we want to check the neck here for a nuchal cord, and if that's too tight, we may have to do a somersault manoeuvre, otherwise we can just unloop it around the baby's head. We then want to see the baby's head restitute. Yep, so it's going to turn 90 degrees to face mum's inner thigh. We place 2 hands on the baby's head and apply slight downwards pressure to birth the anterior shoulder, and then upwards pressure to birth the posterior shoulder. We're then going to feel the baby's, check if its airway is compromised, and at the same time feel for the fetal heart rate. And we're going to dry and stimulate the baby, and using a clean blanket, wrap it and put it on mum's belly. So we then want to use that information to determine our APGAR score. So here we want to know the colour of the baby, its tone and flexion, the irritability or crying of the baby, as well as the fetal heart rate, and we can use that to put together an APGAR score at 1 and 5 minutes. We then want to remove the bluey and set up a new area for the birth of the placenta. Here we're expecting a fresh show of blood and lengthening of the cord to indicate that that's about to happen. We can also note the time that the baby was actually born onto the belly. So as we see the cord coming out, we don't want to apply any traction to it. We just want to allow this to happen normally, and we haven't given any uterotonic medication. So all we want to do when the placenta is coming out is twist it to make sure that all membranes are included and no retained products are left. We then want to cut and massage mum's fundus and continue doing that, or our second officer can continue doing that while we remove the placenta and set up a new bluey. We will then encourage mum to begin the first feed of the baby. This will help release oxytocin, which is important in contracting down the uterus. And we will continue to reassess both mum's and baby's vital signs on the way to hospital.